In this module, I wanted to shed some light on the day of surgery. While your surgery may be different, the basic premise is relatively the same or very similar. There are clear directions prior to surgery about when to stop eating, some written instructions that you must follow, and whether or not you should take your daily medications. The other thing that commonly is used before open heart surgery is HibaCleanse, which is a specialized red soap that kills bacteria, and generally they want you to shower with that the night before and again the morning before surgery. The other thing is an antibiotic gel or salve that's placed in the nose, usually again the night before and the morning of, or potentially longer depending on your unique situation. I wanted to share just my day of surgery, not that yours is going to be identical, but just to give you an idea about the flow of the day and what to expect from open heart surgery. And so I woke up at 4:30. I took my heart medication, my blood pressure medication with a sip of water, took my shower, put the goo in my nose, wore some sweats and some comfortable clothes because I knew I wouldn't be getting dressed really for probably another week. And I got to the hospital at 5:30. Got checked in, and there's my bracelet as I'm walking to the pre-op holding area. There's the view from the pre-op holding area. The middle picture's EEG leads, which monitor brain activity. Those were quite interesting. They were placed with glue and hypertonic saline, which is just a concentrated salt solution, which stung and burned and hurt like hell. The guy smiling to the right is my college and medical school roommate, who is a pediatric surgeon, Dr. Spildy. And there I am on the far right, completely shaved, which is an interesting experience to have basically from the neck down to the ankle shaved, with my wife chuckling at the bedside. So as I was in the holding area and the nurse did the shaving, some IVs were started, and basically slow preparation for surgery, used the bathroom quickly and waited for the variety of other people to come in, like a parade of characters, the nurse anesthetist, the anesthesiologist, the OR circulating charge nurse, and a variety of other people. And so around 7 a.m., the anesthesiologist came in and reiterated the risks and talked about all the lines he would be placing to help monitor and provide me care, such as large IVs in the groin, a wrist arterial line to monitor blood pressure, and a line in my left neck, which would then flow into my heart to monitor lung pressures and fluid dynamics. And of course, the Foley catheter, because I wouldn't be getting up to pee anytime soon. Around 7:10, the head OR nurse came in just to make sure I didn't have any last-minute questions. I chatted with my friend, had a few minutes alone with my wife, and that was very, very stressful with her crying and telling me that I needed to return to her, no doubt. I had some worries in my own mind about operative mortality, but wheeled into the OR, and it was interesting as I was going down the hallway. It was a very long corridor. There were so many patients ahead of me. It was like I was at an airport in a flight line with patients going left and right and following the digital signs along the way. I went into the operating room and I was sort of taken back by all the people and equipment around. I knew this was a big surgery, but I was surprised at how packed the room was with people and machines. The head nurse placed a sticky pad on my butt because I'd be laying there for 7 to 8 hours, and it helped prevent any skin breakdown. I slid myself over to the operating table, and the EEG tech ran me through some commands to make sure her equipment was working. I was told that music would be playing, and it was silent, so I requested some U2. Unfortunately, they picked With or Without You, which is really one of my favorite songs, but I began to tear up a bit thinking about my wife and my family. As the anesthesiologist was hovering over me because he wanted to get busy placing all the lines, the nurse anesthetist tapped me on the shoulder and said that they'd take good care of me. The nurse also rubbed my shoulder, and as I was breathing oxygen, I could feel the icy hot sedation flowing through me. The nurse anesthetist told me one final time, have a rest, good rest, no worries. And my entire body felt warm and heavy. I tried to sit up but couldn't, and everything was becoming brighter and my vision was narrowing. And the song With or Without You was fading. My final remembrance was saying to myself, all right, God, I'm in your hands now, but I want to come back, please. I felt like I was flying, everything was bright, and that was the end of my conscious memory. Surgery started around 8:30. They cooled my body until my EEG showed no brain activity. It was completely flatline. They put me on bypass and stopped my heart, so essentially I was dead from somewhere around 9:30 until 2:30, which still to me, to this day, is bizarre. And I still have dreams about it. I'm not sure what they mean. They're sort of indecipherable, but definitely a game-changing, life-changing event nonetheless. The surgeon went out to update my family around 3:30, letting them know that everything was fine, there was no surprises, they were slowly warming me up, and that they could see me in the ICU shortly. It took a couple more hours to finally get my body temperature stabilized, and I went to the ICU around supper time. I warned them ahead of time that I tend to get a little bit agitated and flail around when I'm woken up from anesthesia. Unfortunately, they woke me up briskly, and exactly that happened. I was pulling in my breathing tube, my IVs. Fortunately, my wife and sister-in-law there were to calm me down. They sedated me quickly, and about an hour later, they began the slow process of extubating or taking the tube out. If you want to see a video where I discuss what it actually felt like, you can see that in the extra section. Around 9:30, I began joking, writing funny things on paper. I wrote on the back cover of my wife's book that she was reading, "Don't bring a knife to a gunfight." It honestly was a pretty rough night. I had lots of pain. My blood pressure was very low. I was getting medications and fluids. There was a pacemaker going, which was causing my whole body to shake and quiver as my heart beat. And it finally got me stabilized around early morning. I slept for a few hours, and then the day crew came and promptly got me out of bed into a chair, which was very challenging. I promptly threw up everything I had just eaten, the Jello and the juice I drank. Sat in the chair for a couple hours, and then finally was transferred to my hospital room where I'd stay for the rest of my hospitalization. And you can see a picture to the left there is what it looked like when I was in the ICU with all the medications, the IVs, the sedation, the ventilators. The tubing is the blue and the white tubing on the right of the screen. The mess of wires on the left side is a combination of my EEG brain monitoring and also my Swan Ganz catheter, which you can see better in the upper right picture, the blue and yellow thing sticking out of my neck. And the bottom right picture was just the night before, out to eat and have a few cocktails with my family and friends. I present this not to say that this is exactly how your day is going to go, but I'm quite confident it's going to be fairly similar, and I just wanted to give you an idea about what's in store.